around the world. In early March, the McLennan County Leadership Response Team, which I will introduce a little bit later, was formed to monitor the situation and to help keep the public informed during a time of rapidly changing events and sometimes confusing and contradictory statements about the dangers that this disease poses. The Waco community has worked together to voluntarily adhere to the recently implemented social distancing measures, and we thankfully have not yet had any confirmed cases in McLennan County. However, there continues to be community spread of COVID-19 throughout Central Texas and the rest of the country, and the City of Waco is taking these steps to minimize the risk to our community. On March 14, the City of Waco took the difficult, and I believe unprecedented step in our city of closing city facilities such as zoos, libraries, community centers, and others. Our faith-based community, businesses, and other organizations have voluntarily limited gatherings and in some cases have ceased operations. And I want to applaud those who have taken voluntary measures to help us as we fight this disease. We are very grateful for them and for the spirit of cooperation that these organizations and businesses have exhibited as we all work together to try to reduce the impact of COVID-19 on the people of Waco. To date, as I said, there have been no confirmed cases of COVID-19 in McLennan County. However, as of yesterday afternoon, the Texas Department of State Health Services reported 57 cases in Texas, including a case in Bell County and multiple cases in nearby Dallas, Tarrant, and Travis counties. We will continue to coordinate with leadership at the county, state, and federal level, where we believe at this time we must take more aggressive steps to prevent the exposure of the virus to the citizens of Waco. It is our desire to flatten the curve, that is, to reduce the speed of community spread. Through the cooperation of our residents, listening to our public health experts, and practicing socially distancing protocols, we can reduce our risks. Additionally, we will slow the transmission and alleviate the impact on our healthcare system. Before I get to the next part of this, I do want to introduce our McLennan County leadership team. These are made up of local leaders in health and disease control. From Ascension, we have Dr. Brian Beckner, Dr. Richard Haskett. From Baylor Scott White, Dr. Jim Morrison. From the City of Waco, myself, Deidre Emerson, Dr. Carly Varner. From Premier, Dr. Paul Hamilton. From the Clinton County Medical Society, President William McCunniff will be joining us beginning tomorrow. And from the Family Health Center, Dr. Jackson Briggs, Dr. Ben Wilson, and Dr. Kelly Reynolds. All these people have been working since early March to help us develop protocols and determine how we should adapt to the changing environment. We will be working with that group again beginning tomorrow to help us come up with some very practical things that we can tell our citizens about what they should be doing to protect themselves. At this time, the City of Waco is hereby declaring a local state of disaster and public health emergency. We strongly urge canceling, rescheduling, or not attending non-essential events with more than 10 persons present. And we strongly urge all high-risk individuals, as defined by the Centers for Disease Control and Prevention, CDC, to cancel, reschedule, or not attend non-essential events of any kind, of any size. We will continue to provide city services as normal to the extent that we can. That means all trash, water, sewer, all of those things will continue. We will have regular city council meetings. We have taken special provisions to follow CDC guidelines for social distancing. Remember, our council meetings are also televised live and available online. I'm sorry, I am missing just a minute. Gap in my notes, I apologize. As part of the declaration, all public or private community gatherings, which I will define in a moment, are hereby prohibited anywhere in the City of Waco. A community gathering is defined to mean any indoor or outdoor event or convening, subject to certain exceptions, which I will describe in a minute, that brings together or is likely to bring together 50 or more persons at the same time in a single room or other single confined or enclosed space, such as an auditorium, stadium, indoor or outdoor, tent, arena, or event center, music venue, meeting hall, conference center, large cafeteria, or any other confined indoor or confined outdoor space. In addition, restaurants with or without drive-thru services, drive-thru restaurants, microbreweries, micro-distilleries, or wineries may only provide takeout, delivery, or drive-thru services as allowed by law. In addition, businesses with alcoholic beverage consumption or on-premise consumption, including bars, lounges, taverns, or private clubs, shall close. In addition, all indoor recreational facilities, including gyms, health studios, indoor amusement facilities, including bowling alleys and pool halls, and theaters, shall close. Going out only while necessary, telecommuting, using online services where available, and frequent hand washing are all important steps to slow down the spread of this disease. We know some of these steps are costly and disruptive, but they are necessary as we deal with this healthcare challenge. I am proud that our citizens recognize that we all have a responsibility to help stop the spread of COVID-19 for the good of the entire community. At the city, we are continuing to serve our citizens and urging residents to continue to take advantage of city services. Let me say that this is a very difficult decision. It was made after much deliberation. We realize the impact to business owners and to employees across our city. Many of us on the council are involved in business. We understand this. We are suffering too. We know that we will not suffer in our businesses to the extent some of you will. We will work with all three of our local chambers to endeavor to find ways to support you going forward through this crisis and as we recover after this crisis is over. I can't tell you how difficult this is and how much we all feel for those affected hereby. Just a minute. We must continue to follow recommendations for social distancing by maintaining at least a 6-foot distance, avoiding large gatherings, protecting the elderly of those with chronic medical conditions, and keeping up with recommended changes when they occur. Our city website as well as our Facebook pages are updated and will be further updated with new information as it becomes available. All of us will be washing our hands instead of shaking hands, a small price to pay for added safety. Testing for COVID-19 is available for anyone meeting U.S. Centers for Disease Control guidelines if ordered by their physicians. As your mayor, I'm proud but not surprised by the way our community has come together, acted responsibly, and looked out for one another. We are working together to take the steps necessary to protect each other and avoid overwhelming our medical services. We are all grateful to the medical professionals in our community who are on the front lines of this challenge. I had a question, when will this take effect? It is scheduled to take effect at 12:59 p.m. tonight. We'll take more questions after we finish our presentation. I would like to now introduce Dr. Brenda Gray, the Director of the Waco McLennan County Public Health District, to provide the latest information on this challenge. Thank you.
I want to first take this opportunity to give honor to the city manager, Wiley Stem, my ACM, Deidre Emerson, and recognizing John Kennard, because they're the leaders who I report to directly, who provided immense amount of support for our efforts at the Public Health District. And I just want to say thank you for that support, because it's a time that we need that support. The slide behind me provides a visual for the impact that we can have as a result of our collective efforts. Our goal is to flatten the curve, to reduce the burden of illness, as well as not to overwhelm the capacity of our healthcare systems. Since the beginning of the year, the core preparedness team has engaged in a build-up period to increase the state of readiness. We have also joined daily calls to the CDC, DSHS, and other pertinent resources. We have interpreted information and guidelines for our crisis and emergency risk communications plan. We've also convened various meetings to provide guidance and information to many community partners, and we have implemented just-in-time trainings, as well as responded to the 24/7 infectious disease line and the general public health line. The core team is also actively engaged in containment and mitigation efforts through the coordination of sample collection and facilitation of transport to the state lab. We are also actively monitoring and conducting contact tracing. In addition, we have established and convened the McLennan County Leadership Response Team. The purpose of this team is to provide a forum for the public health and healthcare ecosystem leaders to discuss updates, challenges, strategies to collectively combat COVID-19, and to provide strategic public communications and messaging. We've also established and convened the McLennan County Local Response Team of trusted leaders to support planning and implementation of actions agreed upon by the Leadership Response Team. Our core response team has implemented a strategic communications approach to dissemination of information. We have developed messaging that has been released to the public as well as to the city of Waco. And we're providing daily and weekly updates across numerous entities, including healthcare providers, school superintendents, school nurses, daycares, nursing homes, preparedness contacts, EMS, law enforcement, and fire, businesses via the chamber, mass gatherings, as well as the faith-based community. I want to emphasize that the Public Health District is well prepared and has the capacity to continue to protect the health and safety of the public with the support of the city, our partners, and the citizenship. Lastly, I want to speak to testing. The current CDC recommendation is, if you think you have been exposed to COVID-19 and you develop a fever and symptoms such as a cough and difficulty breathing, or have underlying chronic health conditions, call your healthcare provider. In regard to access to testing, the health district does not perform testing for COVID-19. However, we provide guidance and assistance with tests, getting tests approved if guidelines are met for testing. And we can facilitate coordinating the transportation of the sample to the state lab. And I want to reiterate CDC's recommendations to reduce the risk of infection. Regular hand washing, covering mouth and nose when coughing or sneezing, avoiding close contact with anyone showing signs of respiratory illness. Avoid touching your face with unwashed hands. Disinfect regularly touched surfaces and objects. Use alcohol-based hand sanitizers if soap and water is not available. And if you're sick, stay at home. And if you're experiencing severe symptoms, contact your doctor before going in. I want to thank you for joining us today in this strategic communications event. And I'd like to bring Kelly Crane to the stage. She's going to read a statement from Baylor Scott and White and Ascension in Providence as she approaches the podium. Thank you.
Thank you, Dr. Gray. My name is Kelly Crane. I'm the Public Health Information Specialist for the Waco McLennan County Public Health District. Baylor Scott and White, Ascension Providence, have asked me to read the statement on their behalf. They will not be taking questions today, and if you want any specific questions about their facilities, please contact their communications directors. Baylor Scott and White and Ascension Providence are grateful for the ongoing support and leadership of Dr. Gray and the Waco McLennan County Public Health District in addressing COVID-19 outbreak. The three institutions, along with the Family Health Center, have developed the McLennan County Leadership Response Team dedicated to COVID-19 preparedness. Rest assured, our top priority continues to be the health and safety of our local communities. Leaders and clinicians from each organization meet regularly to discuss operations, preparedness, public health messaging, and community needs. We are privileged to have a strong healthcare partners in Waco, and we want you to know our organizations are united in providing appropriate access to care, as well as much needed information and resources to our community. Thank you. At this time, we'd like to invite the McLennan County Medical Center representative to give a few words.
Good morning. On behalf of the physicians of the McLennan County Medical Society, I'm here to let you know that we stand ready for COVID-19. The doctors are prepared, Waco is prepared, and our community is strong. We will continue to provide the best possible care for each of you and stand with you during these times of uncertainty. We very much recognize that this is a new virus, and so we have evaluated the latest data and guidance, adapted to best practices, and are actively communicating, cooperating, planning how we can best protect and treat our community. As physicians, we train for situations like this, and you can rest assured that we will be a strong, cohesive medical force today, throughout this outbreak, and into the future. Thank you.
Thank you so much, Doctor. And our next speaker will be Dr. Jackson Griggs from the Family Health Center and Dr. Ben Wilson.
So I'm Jackson Griggs. I'm a family doctor by training and I'm the CEO of the Family Health Center. And I want to start off by thanking Mayor Deaver. I want to thank Dr. Gray. I want to thank Deidre Emerson, who I know have been working very, very hard to get this right. So from the Family Health Center, I think I speak for our whole medical community in wanting to share our gratitude for your city and public health leadership. This is a hard moment. Schools are closed. Grocery store shelves are empty. For our patients, work and paychecks are uncertain. Cable news is COVID-19 24/7. And I want to specifically address Family Health Center patients. There are those among you who feel particularly vulnerable. You may have a chronic illness, diabetes, heart disease, lung disease, kidney disease, liver disease. You may be living together with another family in a home, and you feel crowded. You may be a grandmother or great-grandmother who is caring for your grandchildren or great-grandchildren and feel particularly exposed. Things in general feel pretty uncertain right now for you, and I want to share with you that the Family Health Center stands with you, and we will stand with you through the entirety of this pandemic. Whether you're exposed to someone with COVID-19, whether you have symptoms of fever or cough, or shortness of breath, or whether you just need routine follow-up for your chronic medical conditions, or for your well child care, or for your prenatal care, we will be here with you. This week and in the weeks to come, we'll be making several adaptations in how we operate our clinics to accommodate people's needs during this pandemic. We've chosen to update our patients on a routine basis through our website. So I'm going to give you our website address right now. So write it down, or at least Google us and find us. That website is www.wacofhc.org. So www.wacofhc.org. Finally, I want to say two things. First is how proud I am of our community. Joining forces, even while social distancing in a time like this. While health leadership is doing this in a way coordinated by Dr. Gray and the Health District, I also know that many of you are caring for your neighbors who are afraid. And as this virus emerges in our community, you who are younger will reach out to those who are older and do some shopping for them and bring groceries and leave them on their front doorsteps. You who are healthy will check in on those who are uniquely vulnerable or who are sick. I think this is what distinguishes Waco. It is loving your neighbor is what makes Waco, Waco. Second, there are two critical things I want to share with you that you can do to save lives. We all have a role to play, and this is real. You really do have a role in saving lives. The first is stay home. As much as possible, stay home. Carefully follow the mayor's instructions and prohibitions. Avoid getting more than 6 feet from someone. If you really must meet someone face to face, do it outdoors and do it with some space between you. I think Dr. Gray already emphasized the importance of flattening the curve, but I think in the Q&A, if there's further explanation that's needed, we can talk through why that is so important, why that saves lives. The second thing that I want to share with you is please don't go to the emergency departments for coronavirus testing unless you are so sick that you would go to the ERs anyway. Unnecessarily exposing others to the novel coronavirus is dangerous and is in many cases unnecessary. So with those two things in mind, I want to pass the mic on to our Associate Chief Medical Officer, Dr. Ben Wilson. Dr. Wilson is an internist who we have deputized to lead the COVID-19 from a medical standpoint effort at the Family Health Center. So Dr. Wilson.
Well, good morning and thank you everyone. It really is a pleasure to be here from a doctor's perspective and speak a little bit from that point of view. Hello to the citizens of Waco and McLennan County. As I said, I want to start by, many of us, we're in some ways almost encouraging people not to come to the doctor. If you're otherwise not feeling terribly bad and you think you're sick, then it's good to stay at home, to practice social distancing. The vast majority of people with coronavirus, the vast majority will be okay if they just stay at home. So the question is what should they do? What should you do if you have questions, whether you're sick or you're not? Well, while I can't speak for all health systems in town, I think there are some common themes and some good rules of thumb from a doctor's standpoint that you need to be doing. And one of them is to go to our website, whether it's Ascension Providence, whether it's Baylor Scott & White, Waco Family Health Center, Premier ER, if it's some of the specialty clinics or independent practices in town, go to our website first. It's very easy to overload the system with call volume, and so first, if you're wondering what to do, go to the website. Okay. It's also, though, if you don't get your answer on the website, then call. And so the various health systems in town, there's some that have a hotline, there's some that are simply saying, call your doctor's office, the very number that you've been calling for years already. Just call that same number, and then we'll direct you to the right place if you have a question about coronavirus, whether you have it, whether you're potentially exposed to it. So go to the website first, and then if you don't get the answer you're looking for, then call the number that potentially you've been calling already, or if there's a hotline in place based according to the health system that you seek your care at, then call that hotline. And I want to reiterate what Dr. Griggs just said, and that's that one of the most important things that is going to happen here over these next weeks or potentially to months is that people do not get their care at the ER that do not have an emergency. Okay? And that might require a little bit of shift in thinking on some of our parts for some of us. So, as Dr. Griggs said, if you just need if you think you need a coronavirus test, you might have been exposed, or you think you have symptoms, go to your clinic system's website first. If you don't get the answer you're looking for, call us. But don't necessarily just go to the ER just because you think you may have coronavirus or you want to be tested for it. I also want to say, as Waco FHC, just take a moment to comment on what we're doing, and I think that the other health systems in town are doing things that are very similar. We are adjusting our normal standards of practice and modes of practice, okay? And so this is, a pandemic does not come along just every day or every year, right? And so we're going to be doing things a little bit differently. We appreciate your patience. Patient care will be delivered a little bit differently than it has in the past in some ways. Number one, you may be receiving some of your care over the phone. You may be receiving more medication refills for longer periods than you had been, which I know makes a lot of people happy, right? You might be cared for outdoors in a parking lot as a part of our social distancing push, countywide and citywide. Okay, so you might be cared for in a parking lot. Same standard of care, just a different setting. Same standard, different setting. If you have chronic medical conditions, then we may preferentially ask you to stay at home. Chronic medical conditions over the age of 65 are higher risk of getting out in public. We are asking people to stay at home. But as what may be happening more and more is that the various health systems in town may be canceling some of their appointments for chronic care that are not essential. And so be aware that particularly for those folks with chronic conditions over the age of 65, people will be more at risk. We may be preferentially canceling your appointments. And then it may come as well to where we're eventually canceling all chronic appointments just to practice social distancing, get people to stay at home and isolate themselves a bit more and decrease their risk of catching coronavirus. I'll also say that just a few practical points, because I don't know that everybody knows what social distancing is. There's a lot of things that sound really, they're attention-grabbing and eye-catching in the medical field. We all watch, the different ER sitcoms, right? They're really interesting. They're full of drama. Well, the very best things that we can do across our country, across our county, are not very dramatic. I'll just say that they're not very sexy, if I could. They're just practicing good common sense. And so social distancing, as Dr. Grigg said, from a doctor's standpoint, stay more than 6 feet away from people that you're around. Don't shake their hand. Don't shake their hand. Cover your mouth when you cough. And if you think about it, don't cover your mouth when you cough with your hand. Try to cover it with your elbow. Because if you cover it with your hand, you're going to be touching other surfaces that others are going to be touching. And they can get coronavirus from you when you do that. When they touch the same doorknob you touch, right? Practice great hand hygiene. Be frequently washing your hands, using hand sanitizer. So these are things that at the end of the day will make the biggest difference, medically speaking, and they're just not very dramatic. They will never show up on an ER TV drama, okay? And then one reflection that many are already saying, and Dr. Griggs already commented on, that this is a time, please let me speak as a doctor here, this is a time not for us to divide, but for us to come together as a community. There are, as I say, not very dramatic, not very attention-grabbing things that will make a huge, huge difference, medically speaking, as this coronavirus phenomenon unfolds here in our community. And one of those things is that we need to be serving each other, okay? If you have somebody that you know that's a shut-in that has, is over the age of 65, has chronic comorbidities, chronic medical conditions, be ready to take them a meal. Leave it on the front doorstep, as Dr. Griggs said. If someone is in isolation, help them out. Help them out. Go get medications for them. Go get them groceries. Serve each other and be there for one another. And so, anyway, be ready to receive care a little bit differently than you were receiving it. And all the health systems in town are prepared and adjusting the situation as it unfolds. And we have protocols in place. We have things that we're doing that's a little bit different, but are great adjustments. So that's all I have. Thank you.
Thank you. I think it's obvious that we've got great medical leadership in our community, and that should be comforting to everyone that's here. I do want to correct one thing I said earlier. I said that the order would go into effect at 12:59 p.m. tonight. I'm at 11:59 p.m. tonight, 1 minute before midnight. And before we take questions, and we will take questions, I want to point out that we have sign language interpreter here. We also have a Spanish language translator, so if there are any questions in Spanish, we can take those. This entire press conference will be translated into Spanish at the conclusion. And before we take questions, I just want to say how proud I am of the city staff and of our council that have been working so hard on this. Our city staff has been putting in untold hours trying to get ready for what's happening here in the city of Waco. We've got city management, city attorney, city secretary, staff that I am so proud of and so appreciative of. So thank you all for your great work. And I'll turn it over to Larry Holsey to moderate the questions. Thank you.
Tremendous amount of information provided, but I'm sure you have questions. So I'm going to try to get to each one of you. We'll do this in an orderly fashion. I'm going to start on this side and hold your hand up and speak loudly, please, so everybody in the room can hear the question so we don't have to repeat it. Sammy?
Just representing Waco Restaurant Association, I'd like to call how long does it take? How long is this policy?
Well, the order will go into effect tonight. It will be effective for 7 days unless and until the council takes further action, which I would expect to happen early next week. We don't know how long it will go at this point, but I would say at least through the end of March would be my recommendation, and I think the health district recommendation to the council, but we will take that up at a future specially called meeting.
With public gatherings kind of being prohibited, how is this being enforced? Are there going to be any penalties assigned?
Well, these will be enforced on a complaint-based basis. They are a Class C misdemeanor for any violation of this order, which carries with it a $1,000 fine, and each day is a new violation and a new fine.
My question is for the health department. My question is for the health department.
Okay.
There had been just like some concerns with people saying, you know, why can't you guys tell us how many people are being tested? Can you kind of address that and talk about that a little bit?
That's a great question, and we had anticipated that. Initially, the CDC recommendation is that we only report positive cases, and since McLennan County does not have any positive cases, we didn't have anything to report. But since January 23rd, the Public Health District has sent 30 samples to the DSHS lab in Austin, Texas. 18 are pending, and 12 were negative.
Thank you.
What's the plan right now with elderly people? Are there going to be welfare checks conducted? How are we going to keep track of those people who live alone?
That's a very good question. The question was, what will we do about people that are 80 years and older or that are elderly and live alone? I honestly don't have a great answer for that. We're going to have to work that out. This thing is changing so rapidly that we are developing this information and our planning for it on the fly. There's a lot of thought that has gone into it, and there probably is somebody in the room that knows the answer to that, but I don't know the answer to that.
Sure. Yep. Okay. So it's a great question, and that is, what do we do when we are asking people to stay at home, and particularly those who are elderly or uniquely vulnerable? And I mentioned this in my prepared comments, but I'll just reiterate it, that while we may look to our city government to do something about that, I think that in this era that we all share a responsibility. Be aware of which of your neighbors need help. Reach out to them, not in close proximity, but either via phone or leave them a note, or even have them open their door and step back and check in on them. So I think this is one of those opportunities for us to be the community that we're so proud of, and that is shared, globally via cable news shows. This is an opportunity for us to be the Waco that we're so proud of, and really come together as a community.
Reports about people who have symptoms who may have traveled
I'll take this first, and then there may be others that want to answer it. Patients are tested based on their eligibility, based on the CDC guidelines that have been established. When a person goes to see or calls a doctor, they ask them certain questions. Those questions are then, as I understand it, referred to the health district for guidance about whether that person is eligible for testing. There are a limited number of tests in McLennan County, just as there are a limited number of tests across the country. We are not in a situation where anybody can just come in and ask to be tested and be tested. They must meet those guidelines because we must reserve those tests for those who truly need them. Is there anybody else who wants to do that?
JB?
So how quickly can you ramp up testing in the community? And if we actually begin to have cases here, how many can you do a week? And how quickly could we be seeing the drive-through testing we're seeing in other communities?
So that's another great question. I'm going to preface it with what the health district role is, and then I'm going to let Dr. Ben Wilson come in and share some more. We know that the current administration has made some commitments around testing, and we still don't have the resources trickle down to the state level, but it's our hope that as time passes within the next couple of days, the tests will become more available. And dishes, I think as of last week, had about 270 tests available, but I'll let Dr. Ben Wilson speak a little bit more about the testing capabilities.
Yeah, just to reiterate, there's a nationwide back order and shortage to some extent. Though, as a health system overall here in Waco, we have enough tests for now to test the people that meet those criteria for testing. And so I wanted to say one thing about that, the criteria for testing, is that it takes into account your probability of having the disease. We have not one single yet confirmed case in McLennan County. So given that we have a limited number of tests, it makes sense to test people that have the symptoms and that were also in a high-risk area. And currently, there are a lot of areas that have a few reported cases that are not considered high-risk areas. Those people have a very low probability of disease, and according to criteria, we just should not be using one of our tests that are limited supply currently. I have limited knowledge on the Trump administration and Google and some of what they're doing. There's Roche Laboratories, and I understand it's come up with a more rapid test, and we're trying to push that out nationwide, it's my understanding, en masse, and just do these mass testing. That is not available here. I've heard that's available to some extent in San Antonio because they've had a few cases, I presume. It's available a lot more in the Bay Area, is my understanding, but that is the extent of my knowledge on this topic.
Take a couple more, and then we'll wrap up.
For uninsured families that might be having symptoms of fever, cough, but they're uninsured, what's your advice for those families as we go through these next couple weeks?
So the question pertained uniquely to those who lack commercial insurance, and the Family Health Center serves about 59,000 in McLennan County, and we don't turn anyone away for inability to pay for their health care. Whether you have public insurance, Medicaid, Medicare, or you lack commercial insurance and are completely uninsured, we will see you. I would say that, again, we don't necessarily want to see you in our waiting room if you have mild symptoms or you think you might have coronavirus and just want to get a test. Please call first. We're happy to give you counsel on what to do given your unique health condition and your symptoms. If you are critically ill, then the ER is still the right place for you. Does that answer your question?
Final question.
For schools, for how long do we expect schools to be shut down for? And I know for some students who are being asked to do schoolwork from home, what's the plan with them who might not have tablets, computers, or maybe even internet? What are their options?
So schools being closed is a question for the school districts. I'm sorry, we don't have that information regarding WISD or any of the other school districts. You're going to have to ask them for that. Ms. Judy?
Thank you so much for recognizing me. Can people walk into the place of business to pick up the food at a counter and then leave the building, or will it need to be delivered to the door? Do we have those things?
I don't think we have those details worked out. The question was whether people can come to the building for a restaurant for food to go, come inside and pick them up, or will they have to be brought out to the car? We'll develop those details right away and get that out.
And one other question, as we stood here today, we talked about our elderly population, and there didn't seem to be a real definitive answer as to what we're going to do. Or is the city going to gather together those caregivers, those people like Meals on Wheels, the church pantries? Are we going to get together? I just accidentally found out about this meeting. We have a place of business, but who's going to feed the people?
Right.
Who's going to
So we have organizations in place that are working on feeding all the hungry, including WISD with their program to feed students. Meals on Wheels will continue their great work. There is no central coordination of that, but that will probably need to be developed in the next few days. As I said, this thing is changing rapidly. I think we're going to wrap up at this time. I'm happy to take some further questions after we conclude the conference. I'm going to turn it back to Larry for a couple final questions.
We're going to have questions this morning, but first of all, I'd like to ask Dr. Gray to come up. She has a final question.
I want to reiterate that the Public Health District, the City of Waco, are well prepared for this challenge of COVID-19. I just want to add to what Dr. Griggs said earlier. Another community resource is 211 that all of our residents can call in and get the referral to resources that are available to us in the city. Thank you.
Okay, we really appreciate you all coming. A lot of great information. I think you can applaud with me the great medical community that we have, the leadership and everything. Let's do that. And also, I want to leave on a positive note. How many people remember today is St. Patrick's Day? Okay, the sun's shining. It's beautiful outside. Give somebody a Waco hug across the 6-foot distance, okay? Thank you very much for being here.
I have a lot, but it's our laws are always
Frequency or?
huh?
Frequency or? This is old.
And they like when I put it on somebody, it just sounds really, really staticky, no matter what the volume is. I need to next time I'm up in Waco, I need to get that fixed.
Usually happens to me.
So what do you think you're talking about? Like, I just
Seeing if you got my shot up on the TV view. So like told me to see. Yeah. Yep. Yep. I'm just working off a lav mic. Just setting up here. Mic check. No, this is Killeen ISD.
So if you put in live for press conference, I don't think it's awesome.
All right. Thank you. Anybody need a mic check while I'm up here? Mic check, 1, 2. I'm not John Kraft, but I'm almost the same height. Everybody got it?
Yeah, we're good.
You're welcome. That was seemed like a little bit of a delay there.
Oh, no, I just recorded.
My voice sounds good on recording.
It's Alex again on TV Orange. Sorry, I accidentally hung up. Could you go ahead and transfer me back over? Yeah.
Busy and slow at the same time.
Just so I can be the producer.
Hey, just keep an eye on it. We're running a minute or two behind, but as we go.
Okay, got it. Yeah, go ahead.
Correct.
So after we finish Kraft's statement, after I have like a few questions, and then right outside this door is our Parkland Elementary food pickup and drop grabbing the meals, so you guys can get some video.
We already all.
Okay.
Yeah.
Making sure.
We were killing time while we were waiting.
Y'all are awesome. You're next.
All right. Take your hand, but not right now.
Does anyone have a?
How are you all today?
Good. How you doing, John?
Everyone's mic is on.
We want to do this now, or y'all needing to? Okay.
Let's get you in focus here.
Can you give a quick mic test?
Sure. Mic test 3, 2, 1. Mic test 3, 2, 1. Everybody okay?
All right, let's go.
All right. Well, let me start. Again, good morning. I'm John Kraft. I'm the Superintendent of Schools for the Killeen Independent School District. We appreciate you joining us this morning. We feel like that it's important to try to convey as much as possible up-to-date, up-to-speed information to our students, our staff, and our community. Let me start by saying this. We recognize, we realize, and we appreciate the gravity of the situation that we're dealing with COVID-19. We're not taking this lightly. We also appreciate and understand the importance of doing what we can to ensure the public health and safety of our community and the entire school district. That being said, we really feel like that we've taken a very proactive approach to this point with the closure of school, as inconvenient as it is, and we realize and recognize this fact, that we have taken appropriate actions in conjunction with guidance that we have received from CDC, from the World Health Organization, and of course our partners here locally and across the state. That being said, I do want to extend a sincere appreciation to the flexibility of our parents, to the hard work of our staff, the support of our Board of Trustees, and all of our community members. I think that it's been very, very overwhelming in just in regards to the support that we have received during this difficult time, because these are difficult times and these are difficult decisions that we're having to navigate and to make. That being said, we're looking at different options. Obviously, school and campuses, district offices are closed this week and will remain closed through Friday. We are looking forward. And we're really looking forward from two perspectives. We do feel the need to try to plan for a resuming of normalcy as quickly as we possibly can. That being said, we also are looking and planning forward at potential online resources, options for students to receive a continuity of educational services from the house. And we're looking at different platforms, again, blended learning, online learning modules, as well as the provision of potential hard copies for students to pick up and to resume, like I say, at the house, assuming that this closure status continues into next week and beyond. This is a very fluid situation, and we just actually met with our district administrative team and discuss the different and various options that we're exploring right now. Unfortunately, I cannot convey what and if and when we will open Monday. What I can convey is that at this point in our planning process, we are planning to try to open and resume school Monday, March 23rd, this coming Monday. That could change. Again, this is a very fluid and a very dynamic situation. In the event that we open and resume classes beginning Monday, we want parents to understand if they don't feel comfortable sending their children to school, they can remain at home. Students can remain at home. We will not be pursuing truancy. We will be taking attendance. We will be providing lunch and all additional services associated with having school, but this is not mandatory for students to come to school or for parents to send their students to school if they're not comfortable in doing so. Also, if students and or staff are not feeling well, they will not be required, obviously, to attend school. In fact, we are going to encourage those that are not feeling well and are potentially ill to stay at home. Abide by the same absence procedures that we have implemented leading up to the COVID-19 situation. Unfortunately, again, we will not be able to convey the path forward until we get a little bit further into this week and we continue to see this situation, how it evolves. One of the things that we're being very diligent is we are going to try to make and continue to make calculated decisions, rational decisions, based upon the situation and how it evolves, which is why we're staying in close communication with our local partners, Bell County Health Department. We're watching the CDC correspondence. We're watching state leadership correspondence, as well as our national leaders as to how to best prepare for the resuming of some form of normalcy. Again, we appreciate everyone's flexibility, patience, and support. This is a very, very interesting situation, to say the least. And we are committed, again, to navigating it, making rational decisions that are going to be in the best interest of our students, our staff, and our community at large. I'll be glad to try to entertain any questions that you may have at this point.
Just one real quick question. If things were to transition to online learning, I know you mentioned something about hard copies. Is that in reference to families that might not be available to access online from home? And what do you mean by hard copies?
Yeah, absolutely. So we recognize that even with some of the provisions that are being provided by our local regional cell phone or data providers, there may be families, students that just don't have accessibility. We're also looking at potentially checking out devices for that accessibility, assuming that there is network connectivity. But kind of the backup plan, if you will, would be the provision of hard copies, textbooks, resources that in essence could be provided to the students outside of an online technology platform.
And then while I have you, is there, I mean, I'm sure everything's up in the air right now as far as discussions and how things will go moving forward. Any kind of timeline as to when we might hear whether or not classes will resume on Monday or if the delay will continue?
Absolutely, and that's a great question. In regards to the situation at hand, one of our greatest resources right now is time. We need time. We need time to see and assess how the situation evolves, again, both locally across the state and the nation, in making, again, rational decisions. And so I anticipate that we're going to work, obviously, very diligently towards a Thursday evening, Friday decision-making protocol as to whether or not classes resume on March 23rd. But at this time, again, we are in a planning and assessing before we go forward in making that decision.
How often are you guys meeting to assess the situation? You mentioned how fluid it was. How often do you guys kind of check in with planning?
We are in the process of planning meeting daily. And so this process actually began through the course of our week of spring break last week. And so we are conducting daily conference calls in and amongst district administrative groups. There are subgroups, subcommittees that are also meeting, teleconferencing daily. And then we are obviously on daily phone calls or conference calls with the Texas Education Agency as well as our local and state officials.
If this does end up continuing and pushing back and keeps delaying coming back to school, do you guys have any plans in place on how you plan on reaching students that might have specific requirements that need aids or things like that? How do you guys kind of plan on tackling those students?
We're going to have to assess and address each situation, I'm afraid, individually, which from an online distance learning platform creates some challenges. But I will assure you, from again a continuity of instruction, we're going to do everything possible to ensure that students receive the very best educational services provided, whether that be via an online platform and/or, of course, face-to-face. Again, our objective, our goal at this point is to try to resume normalcy and classes on Monday, March 23rd. That is fluid, and it can change between now and then.
And do you plan to make up days on the school year?
Yes, we're going to be working in conjunction with TEA, Texas Education Agency, in regards to the required minutes or days of attendance. At this point, we've really put the extension of the school year and calendar planning for the 2019-2020 or current school year on hold. We feel like that it's more prudent to really focus our efforts on how do we provide the continuity of instruction, whether it be at school, face-to-face, and/or online, or some other alternative. That's really our priority and our focus at this point. In the event that we have to extend either the school day itself to meet minute requirements and/or the school year into the month of June, we'll communicate, obviously, that need. But right now, that is just not our focus at this point.
And what about teachers? Will they still be getting paid as usual? Or?
Yes, so all district employees, per board policy, provides me as the superintendent to continue their pay. So for this week, while we are closed, all district employees are being paid. And we'll continue, again, to assess, and that will obviously continue in the event that we extend the closure into next week and/or beyond. This is one of those variables, again, that we're having to work pretty diligently with our human resource department, communicating with our employees to ensure and they know that their jobs during this time period are in fact safe. And again, we're going to work very diligently to try to resume a normal schedule.
With the cities around locally, such as Waco, just announced that they're closing all bars, restaurants, things like that. If Killeen decides to do that, is that going to be a sign that schools will be closing as well?
Well, again, we're really relying heavily on the guidance from the CDC. We're again assessing and we're in coordination, collaboration with our local officials. That will be one factor that we will definitely look at and take into consideration. Again, we are going to work diligently, though, to really think through from not only a short-term but a long-term effect that this potential situation is going to have, and make the very best decision for our community that we can.
And is there an avenue for parents that might not know how to approach the situation right now as far as homeschool? Is there an avenue for them to get information or help if they need it?
Yes, absolutely. We really encourage our parents, our families to tune into our district webpage, KilleenISD.org. We've actually set up a COVID-19 site specifically to address questions that parents and or families may have, but also to convey this important information. And so we are directing parents at this time to our district webpage and our resources, as well as our social media channels for the conveyance of that information.
What's your message to seniors who are kind of don't really know what their future looks like?
To our seniors, we're behind you 100%. In fact, we spent just the vast majority of our meeting this morning discussing the way forward for seniors. We understand commencement exercises and the high school graduation and diploma is a milestone in our students' life. I will also venture to say that, unfortunately, with this particular graduating class of 2020, in my educational career, I have not experienced anything quite like this. And so we are going to do the absolute very best to ensure that our students have the experience of completing a high school diploma and graduating from a Killeen ISD high school that is just as special as the previous classes before them. There are some challenges associated. Unfortunately, again, I can't provide a definitive answer as to what their commencement exercise will look like at this point, but we are going to try to, again, resume normalcy as quickly as possible to include commencement and graduation exercises.
What is your message to parents right now that might not understand that you have free lunches and stuff like that? What's your message to help them understand the situation?
Absolutely. So we have, again, established 12 campuses, excuse me, that have been designated, again, via our correspondence webpage. We've also sent ConnectEd call messages out to all of our parents to check out. Free lunch, free breakfast is being provided from today, obviously, into the future during this closure time period for all students. Any age are able to participate in that program. And so we encourage them to check out those sites, and we will continue to analyze if we need to expand to other district locations. We're preparing to do so at this time. My message to parents is, again, we apologize for the inconvenience. I am personally asking parents to relax. This is a situation that we all comprehend and fully understand and are beginning to understand even more so as we move forward. And we are going to make, again, rational decisions and try to resume normalcy as quickly as we can. But there are some dynamics that are simply just out of our control right now that we're going to have to work through.
We're hearing a lot about social distancing. If you guys plan to come back to school, how do you plan on implementing social distancing with classrooms, with the younger kids, things like this? Obviously, the older kids can understand keeping a distance, but those younger kids don't really have that recognition.
Yeah, so again, we're going to treat this, especially with our younger students, elementary students, as a great lesson in appropriate hygiene, washing hands, following CDC protocol and procedures. We're looking at different options to limit the socialization periods, i.e. large lunches, and different ways that we can actually help to create that social distancing. But again, if you look at CDC's correspondence, while it is being asked and recommended, one of the areas that I think that they recognize is when a school system functions as it is designed to function, there are just some challenges associated with maintaining that 6 foot separation. We're going to work to try to, again, educate students and spend a lot of time creating and engaging students in this educational opportunity, because this won't be the last situation that we're dealing with a virus and the potential spread of a virus. And so let's use it as a learning opportunity, and again, try to abide by those recommendations as best we can, knowing that there are just going to be some associated challenges. But again, encouraging appropriate hygiene, that will be a very, very significant initiative, obviously, if and when we return to school next week.
And it's been mentioned by a number of officials, like not meeting in groups of more than 50, not meeting in groups of more than 10. Is that something that you guys are still monitoring, or how is that playing into your guys' planning?
Yeah, absolutely. We're absolutely taking that into account, and we understand that there has been some there have been recommendations that have been provided to the general public. We're taking those into account. We're also looking at community spread as it's being defined. And again, that's why I emphasize this is a plan as of now. It's fluid, and it can change between now and Monday, March 23rd. But I do feel like that looking at our community and our community needs, we need to continue to target and work on a plan to try to resume a normal class schedule. Again, the notion of compulsory school attendance and mandating students bring their children to school, we're going to be very, very flexible with. It is going to be, again, if parents don't feel comfortable bringing their children to school, they can remain at home or under the provision and care of someone. But we really are analyzing this very closely, and resuming some form of normalcy is the objective immediately in front of us.
And then my last question for you is, you mentioned that this is probably not the last instance where the district will face a virus. What have you learned from this instance on how to approach these situations in the future?
Well, I think that the biggest lesson learned at this point is, again, to try to create time to make rational decisions. Don't overreact. Relax. Do not create panic. And that is what we are working diligently to do. No, we will not diligently work to place people in harm's way. At the same time, I do believe that reducing public panic right now is going to have to be an emphasized priority in order to be able to move forward through this.
Any other questions?
Again, we have our board president, Mr. Lawler, with us. He has obviously been very in tune to the situation as it has evolved, and I'd like to introduce Mr. Corbett Lawler, our board president, at this time.
My name is Corbett Lawler, and as you know, I'm the board president.
If you'll speak up, sir, the microphones are there and we've got to listen.
Okay. I don't like to speak in public. Don't enjoy it. Don't feel I do it well. But listening to Dr. Kraft, something came to my mind that I felt like I had to share with you, and want you to share that with your viewing public. I have never in my life, as an educator for over 50 years, seen the kind of panic that we're dealing with here. I was the high school principal at Killeen High School when we had the Luby's shootings. My own daughter was told that her dad had been shot. Several friends were told that I had been shot. And it just created all sorts of panic in the community. I was principal at Killeen High School when the 911 incidents occurred, terror incidents. And I've never seen the panic that it created like I've seen it here. I'm beginning to wonder if the virus is our problem or if the panic that's being created is our problem. And I don't know the answer to that. And I also, I don't know the answer to that. But I am very happy as a board president, as a member of this community, I am very happy that in such a fluid, panic-ridden situation where decisions have to be made on the fly, on the run, minute by minute, I am very happy that we have a superintendent like Dr. Kraft at the helm. I think the way that he has managed this has just been phenomenal, and we've had some great superintendents in our district, some wonderful men, and I think that Dr. Kraft has joined that class of great superintendents, and we're happy to have him. Thank you, Dr. Kraft, and thank you.
All right, this is our press conference is over. We appreciate you guys all for joining us. We'll keep you updated on the social and of course during the press conferences.
Thanks, guys.
Anything else that you guys needed? Everyone's good?
No.
I was trying to get him to stop hitting this, so I apologize. I saw his hands were hitting it. Anything
Well,
else you
worse
need?
things have happened.
That's true. And if you haven't seen it, has everyone seen the feeding or gotten the video that they needed?
Yeah.
Okay, so y'all are all good.
Yeah, we're good on that. Thank you.